Investec's Health and Wellness Show, where we focus on equipping you with the knowledge on health and wellness to help to ensure a more productive and healthy life for yourself, your families, and your employees. Today, the conversation is about malocclusion, also known as bad bite, a medical condition in which one's upper teeth and lower teeth don't fit together correctly. Not only does bad bite affect the jaw and alters the face structure, but it also affects the rest of the body as well, causing issues such as headaches, neck strain, and muscle spasms. To bring insights on this topic, we have Dr. Beh Wee Ren. He's a clinical consultant and implantologist, as well as the president of the Malaysian Association of Aesthetic Dentistry. Dr. Beh, welcome to the show.
Hello, hi.
Now, Dr. Beh, can we start by getting an overview of your medical background and what you do?
All right, sure. So I am a dental entrepreneur and I own a dental group. Yeah, but I'm a full-time clinical consultant where I really practice dentistry hands-on. Actually, I have a dental group that we have 26 clinics in KL, in Klang Valley. And just now you said that I'm the president of Malaysian Oral Implantology Association. All right. I'm also the treasurer of the Malaysian Association of Aesthetic Dentistry. Yeah.
I see. And so bad bite is something that's close to your heart. Could you give us an insight into your very inspiring story?
All right. So my story. So when I was young, of course, we want to have nice teeth, right? And when I was young, one of my tooth is jutting out. So I feel a little bit not so confident, and just like everyone wants to be prettier and more handsome. So I went to the nearby dentist to get it soft. But that time I do not know much about dentistry. Of course, I was very, very young. And what happened was that he extracted one side of my tooth, just one tooth. And in less than a year, he finished, done. But what happened is that because the teeth on the upper and lower is not matching anymore,
okay,
my jaw actually swayed to one side and my midline actually goes one tooth away. Because you only extract one tooth, right?
Yes.
So the whole thing swayed away. So through that, actually what caused is that since very young, I always have headaches and always muscle strain on my whole right side. And it's like every week, once I will need to have a Panadol, otherwise I will get even worse. It's that bad. And through the years, as I become a dentist and I learn about bite and how to manage it, I'm able to overcome it. And that's why I'm passionate about sharing how to correct a bad bite. Yeah.
I see. And what are the common signs and symptoms of bad bite?
So the most common one is actually, you can actually see it. That means your upper teeth either too forward or too backwards, too up or too down, or even sometimes straight. And one more common one that is the sign would be when you bite, it does not just bite like that. It bites and then it slides. That means,
I see. Okay.
So that means your upper and lower teeth is not biting properly. And other symptoms, so what I've coined, by the way, I'm a co-founder of this concept called face dental concept. Basically, teeth affects our face. You see, our lower jaw and upper and lower teeth hinges on our jaw, right?
Okay.
Also hinges on our temporomandibular joint, our joint on two sides. Just on the neck.
Okay.
Goes down through your spine or your shoulder, your back. So when your teeth is not biting correctly, it will affect the joint.
I see, which in turn has a ripple effect.
Exactly. You get it. It is as simple as that, but people do not know that it's so important to have a good bite. And that's why some people that has bad bite, like myself, I have a constant strain on my right neck and always having a migraine. So the others, just now you asked, the other symptoms out of it is not only jaw pain, neck pain, shoulder pain, even backache, and some even have sleep problems like sleep apnea. It can be. So I have a patient that he came to me, he lost some tooth at the back. So he was supposed to bite like this. But because he lost some tooth at the back, what happened is that his whole lower jaw slides backward.
Okay.
Right? And when he sleeps upright, right? So his lower jaw at night actually drop downwards when he sleep, and he wakes up at night always. So it disrupt his sleep, he disrupt his dailiness, that means all morning, and he has to go through he went to a lot of medical doctors, and he ended up with an ENT specialist. All right.
Okay.
ENT specialist say you do not have enough oxygen, right, when you sleep. That's why.
Yeah. So that's why you have some symptoms of sleep apnea.
Yes. So what they gave him was something called a CPAP machine. Basically, is feeding oxygen, forcing oxygen into the mouth. That works. That works. But why not, if I can replace his teeth at the back, move his jaw forward, correct his bad bite, he's done.
Okay, so here's the thing. How do I actually know that I've got this? Because Dr. Beh, I think I had it when I was, now that we were talking about this, I had it maybe when I was young. How that was corrected was, and it may be self-corrected also, I was, just before I went off to university, in those days, basically, you had to put plaster of Paris in your mouth if you wanted to put braces. Yeah. And so what happened was, I think I did an impression, and then after that, the dentist removed a couple of teeth from the back. I didn't go to the braces procedure because I was going off to Australia, and it was he said, you know, it's going to be very costly for you to do it in Australia. I mean, this is like 30 years ago, so it's a lot of money, you know? And what happened was, my jaw kind of corrected itself, strangely enough, because I know now, thinking about it, at about 18, 19, it probably wasn't very aligned. And then after I had those teeth extracted, maybe it sort of rebalanced itself. Interesting.
The beautiful part of our body, right, is that our body actually has something called a homeostasis, basically a balancing act.
Okay.
For example, if our bite is slided one side, our muscle actually will compensate to hold down a little. So our shoulder will probably go a little bit like that. And then our pelvic will go another side. So, and also for people that actually train a lot, let's say, for example, athletes or whatnot, they lift the muscle, our structure of our jaw, our spine is held by muscle as well, right?
Yeah.
So this can compensate the side effect.
Okay. So you then, because you realize that if you are properly training, you will realize, hey, hang on here, I'm overemphasizing one side over the other, and you will then train correctly to compensate for that. So essentially, you're naturally, because of training, you are compensating for the disalignment or non-alignment of your body. So this is something, Dr. Beh, which is very interesting, because most of us are just not aware of this.
Because that a lot of people think a dentist are people who do scaling, extraction, filling, dentures, something like that along the line. But neither do they know that actually dentistry is way more than that. In fact, more advanced dentistry is not treating your teeth. You want to treat the person as a whole, right? So if I see a patient, be it from a child all the way to an adult, I would definitely need to look at not the cavity. I need to look at how they bite and how it affects their whole body. I think that is much more important, right?
So how, okay, if I'm a parent, right, or how do I ensure, first of all, that these things don't happen to our children, to my children down the road, right? What are the signs to look out for, and what should I be doing?
All right. So one of the easiest way to look at is look at the tooth first, the teeth, the whole jaw. So if you find that if your kid's teeth are too forward, or the upper jaw is too forward, or the lower jaw is too forward, or even things like they can't bite in the front, that means they bite only at the back teeth, and their front teeth is not touching.
Okay.
Or their upper teeth and lower teeth is overlapping totally.
Okay.
Upper teeth is supposed to be like that, right? The upper teeth should be a little bit in front of the lower teeth, and it's biting a little.
Okay.
Anything that is out of normal, it's good to find a trustable dentist that has knowledge about face dental concept, basically the bite problem. So you can be from a knowledgeable orthodontist all the way to general practitioners that have studied and have special interest in malocclusion or bad bite.
Okay, so essentially then, first port of call in terms of finding the right person would be an orthodontist, because they're trained at that level. Then the second level, you can't find an orthodontist that's close by or somebody that you know, then it's somebody who then has a specialty in this.
But the most important is to find a dentist that is trustable, as well as be able to explain the concept to you clearly. Explain to you, not just come to you, oh, you have this, just do this. A dentist that understands this concept will give you evidence of why this happened, and will probably give you suggestion, and sometimes even work with ENT specialists, or even sometimes I work with chiro or osteopath, where we actually correct the whole body rather than just fixing your teeth.
Yeah, and because it's all back to alignment, right? If everything is out of alignment, now it's just like a car service. Essentially, you got to go, your wheel alignment is slightly out of alignment. If you don't take care of it, there's uneven wear on your tires.
Exactly. Powerful. I really think that is really a good way. Of course, you're still driving, yeah? Your car is
yes, you're still moving, but you realize you're not optimum. Your fuel consumption is different. Your braking is different, so you're not performing, the vehicle is not performing at an optimal level. In this case, then your whole body function is not performing optimally, and it is uneven wear in certain parts of the body.
Exactly. This is the analogy that you give, which I actually wrote down as well. This is the perfect analogy. Your car, if you don't maintain it well, and so that it still functions, but it will be loop-sided and you will have certain wear on that. In fact, in the sports world, in the high athlete world, where they have started to do, especially in the US team, they actually adjust their bike, and they find that when they give them a better bike, let's say for example, they are biking like this and they slide a little bit away. But when we put their bike into the most neutral and comfortable region, what happened is that they tested and they realized that their athletes can perform better in endurance, they become more flexible, they have more stability, and their performance just increase. That is how a bike can change a person.
So this is interesting because obviously, Dr. Beh, this is a hidden problem.
Yes.
Because we are probably looking for different solutions, massages, osteopath, and so forth, without even thinking that it's something to do with our bites. What do we need to do to take action? So in other words, let's say I'm an adult, I'm a 51-year-old adult, I see that I may have a problem. What are the steps that I need to do to take action? And then walk us through then, Dr. Beh, what do you then, as a specialist in this area, do to correct this?
So it is actually a very, very wide field. Occlusion is a very rare field, and every case is very, very specific. I wouldn't say I am a specialist. I'm a general practitioner, by the way, but I do have special interest in this, and I correct it from a simple feeling. Sometimes when our bite is not stable, it's just because our tooth got wear off on one more than the other, and that's how we get a bad bite.
Yep.
Yeah, by just fixing a feeling.
I see. Okay.
As simple as that. Of course, that's the simplest form of correcting a malocclusion.
Okay.
Or to orthodontics, and even myself, I did Invisalign. It's a clear aligner where I arrange my teeth. There are also full mouth rehab where I change the whole thing. Like for example, they have grind off their teeth, whole thing, and we actually increase the bite, get all her teeth right, or even replacing implants at the back. The most important thing is to get our bite into the correct neutral position.
Okay. And how long does the treatment typically take?
If it's a filling, it's probably 15 to 30 minutes.
Yeah.
Orthodontic treatment sometimes will take 30 minutes. 30 minutes. It will take around as fast as 3 months sometimes.
Okay.
Sometimes or up to 2 or 3 years. Depends on the severity of the patient. Yeah. But take note that it is also a balancing act, right? As you said just now, it's a balance. Some part that is aware, you correct that. Then you realize that it is not just left and right, you know. Our body has so many hinges.
Yes.
So if like this, and then I realized that because of this long term, it has caused your spine to have some scoliosis. That means your spine is not straight.
Yes.
Then you need osteopath to correct that. Right. And if it's more of the neck and whatnot, sometimes certain chiros that are really good, they do adjust it as well. And sometimes even podiatrists, where they adjust your legs.
Yes.
So it's multifactorial. It really depends on patients to patient.
Gosh, this is so interesting, Dr. Beh, because the thing is, I think from an awareness perspective, very few people are really aware. That is the last thing we look at. So we always go to we think we're going to the root cause, but we're actually not. We're going to maybe the symptom of it only.
Exactly. Of course, I'm not saying that all of these backaches comes from bad bite, huh?
Correct, because we understand what you're saying. Essentially, this is an area that we never, for most people, we've never even explored. So, you know, you may have, as you said, headaches, and people have been going through and I know a number of people who have headaches fairly regularly. And, you know, for some people, for example, it is because of trauma to the neck. You've had whiplash and all that stuff. That's where your headaches is. Like years ago, I had an accident, and you know, for a long time I had headaches, and the way that was solved is you strengthen your neck and you solve the problem.
That is one of the way. Yeah.
So that's very interesting. So Dr. Beh, this is a fascinating conversation that we should probably have in more depth, and because there's so many different areas. But for purposes of today, as we leave this conversation, what general advice would you give people out there in terms of taking care of yourself from a dental health perspective?
All right. So general dental health, what you meant. So I think your analogy is really right. It's like your car. Every day you need to take good care of it. So every day we do need to brush our teeth, definitely. Yeah. So the standard one will be brush your teeth 2 times a day, 2 minutes, using a soft bristle. You use a fluoridated toothpaste. Or one thing that probably a lot of people do not know. I like to find things that are truth, but people do not know. For example, okay, you're supposed to spit it rather than rinse it out. Do you know about that?
No, why?
Because inside the toothpaste, there is fluoride and medications. That the longer you leave it there exposed, it continues to have effect. If you rinse it all out, then there's lesser effect, right?
Okay, true. Now I want to ask you another thing as well. Why soft bristles?
Okay, so soft bristles is like that because people think that you go to the dentist and they do scaling, they are scraping off your teeth. But you are doing that only once or twice a year. And if you out of 10 years, you are doing 20 times.
Yeah.
Right? But brushing, you are doing it 365 times a year, times 2 every twice a year. So you are doing 800 times a year, and you're doing for 10 years, you'll be doing 8,000 times. So just like water dropping on a stone, you will slowly wear it off. Huh?
Yeah.
It's same as the teeth. So the correct direction is important. So it's always up, down, never left.
Down, okay.
Up, down. Of course, with twirl, if it's possible, from the upper, go down, from the lower, go up. And that's why you need soft bristles. So never go this like that, because you are actually wearing off your teeth.
Right, okay.
Going downwards, right?
Okay.
The way is to go downwards, to clean off. But if you do this, what you're doing is you're actually pushing the foot in between first. Secondly, you are wearing off the fattest part of the tooth.
Right.
So brushing technique is important. Keeping that. Mouthwash is to be used at other times besides brushing your teeth.
Aha, okay. It's like a shortcut only.
Yes, only for temporary. Let's say, for example, you go for lunch and then you find that there's food inside. You want to rinse your mouth off. That you can use mouthwash. Or after dinner, you just feel that your mouth is too oily, but you do not want to brush your teeth yet. You use mouthwash to rinse it off and protect your teeth. But do not brush your teeth right after food. You're supposed to wait 30 minutes or an hour after.
Why is that?
Because when you eat your food and everything usually is acidic a little, it corrodes your teeth a little.
Okay.
But Saliva is a pH stabilizer where it stabilizes everything, balance up everything again. But before you do that, if you start, it's just like acid. If you put on the surface, it corrodes a little. But if you rub it in, it will corrode more.
Ah, okay, interesting. So this is again something that we all do wrongly.
Yep. So try to avoid it 30 minutes or at least gargle and rinse it off. But the last point is definitely, just like a car just now, you need to send to a mechanic for regular maintenance, right? When the time reach there, whether do you have any problem with your car? No, there's no problem with your car. Your car is still functioning. The black oil, the steering oil, the engine oil, whatever oil is still there. It's still functioning perfectly. But why do you need to go to a maintenance service? Because you do not want one day your engine just bursts up and you will cost a fortune to replace the engine of a car, or your car just break down. And that is what happened, you know. A lot of people come to us when they have toothache. When it's a toothache, it's a breakdown already. Basic. Yeah. So if you can go for a regular maintenance, a dentist that you trust very much, and also have very high knowledge that can explain to you what the whole dentistry is all about, I think that's a win. If you can find this kind of dentist in your city, treasure them very, very well. Because I would say it's not so easy. Not all dentists are created equally, but we try our best. All dentists, we swear by Hippocrates' oath not to do any harm. We want to do our best for our patients. But sometimes we are not exposed in all terms, right? In just like business, we will know a lot about business, but there are certain parts of business that you might not have or be aware of. And that's with dentists as well. Yeah.
Dr. Beh, it's been a fascinating conversation. Thank you very much. We've learned a lot. Thanks for being on the show.
Cool. Thank you very much as well.
Now, I'm Brian Fernandez, and we've been speaking to Dr. Beh Wee Ren, clinical consultant and implantologist and dental entrepreneur, on BizTech's Health and Wellness Show. This video will be on our Facebook and LinkedIn sites, as well as our website, www.biztech.asia. Please subscribe and like our various platforms. Thank you very much for tuning in.